state for the record, this is Tabata. I just wanted you guys to know I was in a meeting. I'm on the phone.
Oh, great. Welcome, Kadada. Have you
I was
been
just
part
waiting
of...
for the... I've been listening. I was just waiting for a break so I could intervene and just let everyone know I was here.
Great. Well, we're so glad you're here. Thank you. Rich, thank you for stepping up in that way. Are there any other committee members who'd like to put their names in the hat for the secretary position?
I second Rich doing it.
Okay. Great. So I think we have a self-nomination from Rich and a second from Kit. And it seems like there's been lots of opportunity for folks to participate. So why don't we go ahead and move forward to a roll call vote on the appointment of Rich as secretary, and then we would need to do a roll call vote, I believe, or actually we could do a roll call vote, Rachel, on the whole slate of officers, which would be myself continuing the role of chair, Glenda continuing the role of vice chair, and Rich joining in the role of secretary. Does that work?
Rachel, would it work if we all raised our hands? Would that count as instead of having to go through the entire roll again?
Sorry, that's what the statute says, Crit. So
you attorney. Okay.
Sorry.
Okay, well let's do that roll call vote then on that slate of officers.
Al?
Yes.
Siobhan?
Yes.
Glenda?
Yes.
Jane? I think I saw you say yes. There's a delay on you unmuting.
I'm sorry, there's something wrong with my computer today. It just keeps going into mute. Yes, sorry.
Thanks, Jane. Jasmine?
Yes.
Kadada?
Yes.
Kit?
Yes.
Leslie?
Yes.
Misty? I think I saw Misty join.
Yes.
We'll also mark you as present. Thanks, Misty. Philip?
Yes.
Rich?
Thanks.
Yes.
Robert?
Yes.
Susan?
Yes.
Okay, that motion passes. So Glenda, Rich, and myself will be your officers and executive committee for the year. I'm honored to have the opportunity to do that. And thank you, Glenda and Rich. And Kit, I believe that was our last voting item for the meeting. So.
My cat, you would just make my day.
Okay, let's move on in the agenda. The next old business item is an update on the fiscal year 2021 roadmap that Rachel will share with us based on, for folks who might not have been in our August meeting, we had a great kind of deep dive discussion about a drafted version of this, and Rachel and staff have worked on it and come back with some updates.
Sure. This can be a quick item of business. The updated document reflects the conversation and edits from the committee at the last meeting. I wanted to let you know about a couple of things that we've got slated for the next couple of meetings, which are exciting. In the October meeting, which lands on October 6th, we will have guests locally and from a state perspective sharing about the current state of early childhood education. So that system data that you remember being shared with us last year from Buncombe Partnership for Children, we'll have guests from that organization again sharing the ECE system data as well as perspective on COVID, because as this context in the I keep looking at Kit petting your cat there on my screen. This context of the pandemic has certainly had an impact on our system, on services, and on the ability to access some of the data about the system. So Partnership for Children will be here in October as guests presenting, along with a panel that we're working with them to put together to bring in some state perspectives on policy and funding across North Carolina. For November, I'm working with an outside consultant and still arranging the details of the scope agreement. Don't have anything quite signed, but I'm excited that we'll be able to have a facilitator lead us through some beginnings of our work around equity in grant making. So the group has expressed a desire. The committee certainly has already taken on some activities and expressed a desire to continue doing work with a focus on racial equity and this grant-making process. We've looked at a little bit of equity data about the services, the children and the families, and the access and impact. And this conversation will also help us think about how we consider addressing disparities, but also making a process that's inclusive and equitable for the grant application, the committee work, the grant review, and the funding. So that will be on the agenda for November. Looking forward to that. So you've got that document handy. It's got some dates and times reflected. We'll continue to review and refer to it throughout the year as we set agendas.
Rachel, am I correct that we changed the date for the November meeting?
We changed the date for the November meeting from November 3rd to November 17th because it landed on Election Day.
I just saw the 3rd still listed here.
Uh-oh. I'm looking at one. Okay. What document? Where are you looking at, Rich, so that we can correct it?
Draft for discussion purposes.
Okay.
Maybe that's an older version, 8/4/20.
Got it. I'm looking at buncombecounty.org/grants. That's the meeting materials that I clicked on that I'm referencing during this meeting, and it has an updated version of that roadmap that reflects November 17th as the meeting, and then it does reflect those additional and extended meetings that the group agreed on for the spring grant making period.
I'll find that version. Thank you.
Rachel,
Yes, ma'am.
I don't know if you can see on the screen, Jane has her hand up.
Oh,
I just want to, can you hear me? Can you hear me? Okay.
Yeah.
I just wanted to ask if one of the things that we might look at for that meeting would be the process that CoThink uses. Maybe y'all have already talked about that. I don't know, but I just think that would be a good model to look at.
thank you for that suggestion. The person that I'm in communication with to provide some guidance with us is Tracy Green Washington, who has a consulting firm named Indigo, and she works with CoThink. She also has a lot of depth of experience in philanthropy and grant making as well as racial equity. In addition, serves as a current board member of the North Carolina Early Childhood Foundation. So a real nice nexus of experience.
That's great.
So still working out the details of what that will look like, but we've got sort of a verbal agreement and placeholders on calendars.
Thank you.
Great. Any further questions or discussion about the roadmap? Okay. Thank you to staff for your work on that. Our next item of old business is the report.
Leslie's trying to say something.
Oh, I'm sorry, Leslie. I missed that. My apologies.
I thought I muted, then I muted when Jane was talking. It's hard to keep up. Sorry. This is Leslie. For that November meeting, do you think an hour and a half is going to be sufficient for bringing in a person of that caliber and so forth?
The conversation that I've had with Tracy is that is certainly a very limited amount of time for such a vast topic, and we're balancing the need for the community for the committee to cover a lot of territory with this with this roadmap. So we're framing it as sort of a beginning of the conversation, and we could schedule some additional sessions or follow-up work subsequent to that. If the committee wants to look at an extended session, I can check her availability for a longer period of time that day.
Well, I don't know how she wants to structure it, and maybe it's better to have her come back or something, but we don't really have that shown on our roadmap either. So I would favor maybe expanding her time that day, but that's just me.
I'd agree with that.
And one other, I'm sorry.
I just said I'd agree with that.
And just one other detail. As we update these documents, if we could put a date at the bottom as to which version it is, even though it's in the file, I don't know, like Rich, I print them off so I have them here in front of me for the meeting, and then I'm never sure if I have the latest one or not. So if staff could just get in the habit of putting the date for the latest version, that would be a big help.
Yep, will do. And Misty, you're sharing your screen.
Other thoughts on the idea of extending our November meeting to allow more time with Tracy? Can you do a thumbs up or thumbs down? Actually, and Misty, there we go, thank you. So yeah, thumbs up if you're, okay, looks like we've got some thumbs up on that. Anyone have strong scheduling constraints in terms of whether we would say start a bit earlier or extend a bit later? I know we have the 3 p.m. briefing for Robert, Al, and I.
Why couldn't we start at 12, Jasmine?
Would that work for folks that day?
Very good. Well, I've got a call with Tracy next week, and we'll try and firm that up and get back with everyone.
Great idea, Leslie. Thank you. Okay, anything further on the roadmap? Okay, let's move on to the next item, which is a report from the ad hoc nomination group. Before we get this report, Al, Robert, and I need to do an update from the Board of Commission that I think it may take all three of us to do about how boards and commissions are going to be appointing new members moving forward. And Rachel and Michael, we may need to fact check with you. And I want to just begin this by acknowledging, first of all, thanking the members of the ad hoc nomination group, and acknowledging that we sort of had two processes, two planes crossing midair. One of them was the Early Childhood Education Committee adding new members or interviewing new members, and the other was the Board of Commissioners going through a much larger, longer-term process where we are trying to standardize our policies and procedures across all of our boards and commissions, including this one. So at our last meeting, what we voted to do was, moving forward, have new applicants to the Early Childhood Education Committee and other committees where there are funding allocation recommendations. So that's strategic partnerships, affordable housing, this one, and I believe there's a fourth one I'm blanking on right this moment, where the Board of Commissioners will actually do the interview process for new committee members. And those committees can bring forth written recommendations that are considered as the commission will consider the written applications of all applicants. So that brings some clarity to sort of a question mark we'd had as a committee about how we would move forward with new, when there are vacancies and a need to appoint new members. So I think for the purposes of what's happened right now, I want to again express appreciation to the Ad Hoc Nominations Committee, and we'll look forward to your report. And here's where I'd love Al and Robert and others to chime in. I think the way that this can work is that ad hoc, or pending the will of the full committee, the recommendations of that ad hoc nominating group could go forward as written recommendations to the full Board of Commission, along with all the application materials, and then the full Board of Commission would move forward with another round of interviews in all likelihood before finalizing the appointments.
This is Philip. So are you suggesting that there are going to be 2 rounds of interviews, or
Yes.
that the...
Could I have some input here?
Please, yes. Alan, Robert, yes.
I talked to Brownie just before coming in here, and
Great.
what happened, it almost was a perfect storm. We decided how we would interview at 1 o'clock. Then in our meeting, we made the decision that the board's giving money, that the commission would interview them, okay? And really, I fought me to a lot for it. We didn't put the dots together as we went through the interview process. But Jasmine, what Brownie said, since we are bringing forth 2 names of the people who we interviewed, we'll talk about this in our planning session, and if the full commission will go along with us, we'll go ahead with what we've done now, so that we won't have to interview these people again. But going forward,
Okay, great.
we'll do it the new way, because we don't want to have to, go through that again. Yeah.
That's a much better solution. I'm glad you all were able to confer
Yeah.
about that.
Yeah.
So is that feel clear to everyone on the committee then, how we'll approach this process and then how it will work moving forward? Okay, with that,
So would our committee have input? Would we have a subgroup that would do some of that nominating work, or it would all be done by the commissioners?
Well, I would hope that we could have a subcommittee to sort of pare them down, because this time we had 9 applicants and we interviewed 4.
10.
Was it 10? Okay, and we interviewed
I think
4.
it was 10.
yeah, so I think it's up to this committee if we want to have that nominating group, and that nominating group could prepare written recommendations that would go to the Board of Commission, and then Board of Commission, as I understood where we got to, can make the decision to conduct interviews moving forward. There may be cases in which interviews are not conducted if there's reappointments, et cetera, but the final decision on it will rest at the Board of Commission level.
So this is Philip. So the idea would be that the subcommittee gets applications. Let's just say they got 10 and they were interested in. Would they send a recommendation of a certain number to the commission, and then the commission interviews those people, or does the commission look at the entire group? I'm just a little confused. I'm sorry.
Yeah, the commission wanted to look at the entire group of applicants, but also is open to hearing recommendations from the committee, if that makes sense.
And they would do that before and they would get the recommendations from the committee before they decided who to interview.
Yes, so I think from a process perspective, and please anyone jump in if you're thinking about this more quickly than I am in the moment, but I think from a process perspective, we would open an application process, get X number of applications. If we decide we want to have an ad hoc nominating group, they can winnow through those and come up with some recommendations that come back to the committee, I would think, right? And then all of that is presented as a package to the full Board of Commission. Here's all the applicants and here's the recommended.
Okay, that makes sense. Thank you I'm slow today. Thank you.
No, Al, Robert, Rachel, Michael, does that sync up with where you all are at?
I believe that covers it.
Yeah, that was the intention when we talked,
Okay.
So as staff, we will work with the group that got together for the ad hoc nominating process this time, who is Rich and Leslie and Al, and and prepare a brief written summary that we'll forward to the board. But I'll also wait for a result of this afternoon's conversation among the Board of Commissioners. Chair, would you like a report on that interview process?
Yeah, that would be wonderful.
Oh, yeah, we need to get it, yeah.
Al, Leslie, Rich, I'm not sure if we selected a person to report out.
You want me to do it since I asked the questions? That we came up with? We had 4 good people that we interviewed. 2 were retirees and 2 for the community. It was Brandy Bowman, Begus. What was Begus's first name? I didn't write it down.
Mary.
Mary. Okay.
Dr. Mary. Yeah.
Yes. Yeah. A doctor. And then we had Wendy Weber, and what was Shula? What was his first name?
Stephen. All doctors, all of them.
Yeah, all except
for Brandy, who's on her way.
And she's working on hers. She's starting. And the 2 we came up with after the interviews was from the community, Brandy, she's in community engagement at UNCA, and she's sharp. And then Wendy Weber, who's another one. She brings a lot to the table. She was retired, and you all can help me out. Remind me, she had worked in the field, and what was it, with handicap, hearing
impaired, and
hearing
done a lot of on-site intervention work in early childhood settings. She had worked with J. Iverson Riddle program for a long time.
In Morganton, yeah.
Great, thank you for that report back and to the nominating group members for that process. Any further comments or questions on this?
Is the list somewhere of all the people that applied? I'm just interested in who put themselves forward.
Yeah, Rachel, do you have that? We had it. Yes.
Would it work to put it in the chat?
That'd be great. Yeah. Thanks.
The quality of the applicants was excellent.
Yeah.
That's right. Yeah.
Yeah.
I will say we also screened for conflicts of interest and looked, for that. But we felt very comfortable with the 4 that we interviewed, and were, like Al said, very pleased with the quality. And I will say they were very excited about what this committee's doing and what the commissioners have prioritized, and just grateful to the county for doing this. They wanted to be a part of it.
Great. Well, thank you all for that report out and that work. I think with that, we will now move into new business. And Rachel, I believe you or other staff are going to lead us through both of these items. The first is planning for the grantee COVID meeting, which will happen virtually on September 15th from 1 to 2:30 p.m.
For that item, we'd like to update the committee, since this was scheduled since we last met, that we did get the date and time. Sorry about the mix-up on the dates the first time. It's September 15th, so in 2 weeks, from 1 to 2:30. It's a cohort call, if you will, with 1 or 2 representatives from each grantee organization, as well as members of the committee invited to attend. So it will be a noticed public meeting. And a lot of people all together on the call. And so as staff set up the agenda and structure for that conversation, wanted to ask the committee, do you have any input or guidance that you'd like to offer us in how to best organize it? With the theme being COVID and COVID's impacts on your work.
I remember discussing this, and was it to find out what impact this COVID is having on our investment in them? In other words, our personal interest as folks shepherding these grants, or was it more broad than that, just in terms of their whole organization? I can't remember what kind of how the staff was directing that. I do think there's maybe a difference in what's going on with them at present time and what they may see in their future. And so I would like to, get a sense of that. But I also think it's a matter of, we trying to hone in, on our investment in them, or is it broader than that?
We will have in just a minute another conversation about site visits, which is a time to speak individually with grantees. The overall cohort call will probably be fairly broad because of the number of participants. But just wanting to set it up as in whatever way seems to make most sense. Do we want to have each group take turns speaking out? Do we want to pose a few guiding questions and then let the conversation flow from there?
Rachel, if I could speak, it might be interesting to have a few questions ahead of time, or a survey or something that they could prepare for that. But from my perspective, looking at how staffing changes have affected, how they're tackling some of the issues that are going on right now.
Thank you, Misty. I'm making a note of that question.
And this is Susan Mims. I think I was going to say something similar that, if we just go around, they might repeat the same things. I imagine many of them are facing the same challenges. So if there is a way to give them an opportunity, I do think it would be helpful to kind of quantify how many organizations are sharing, those things. So if we could do that with some sort of a survey or information ahead of time, to kind of collectively get the overall picture. And then I always think it's helpful to hear, their particular stories or experiences articulated, and we could have more time for that.
In addition to staffing, are there any other categories within COVID that you would want to lift up?
I'd like to ask them about what additional resources they have found that they need. Not that we can answer them, but it would just be helpful to have that in the public record as well, I think.
Possibly their numbers and how their numbers have been affected.
And I think they're, I don't know how transparent they can be with their finances, but are they in kind of financial trouble? I don't know. Lots of businesses are at risk of closing or having to furlough people, that kind of thing. And everyone's struggling to find the appropriate equipment to protect themselves, especially our essential workers who are doing this frontline work. So and then to that, I also know that kind of leads into emotional state of mind, emotional well-being of their staff.
This is Philip. I guess I would be interested in knowing if there's the possibility, and we haven't gone there yet, but if there's the possibility that part of our grant making this year could be related to COVID issue relief for early childhood organizations in Buncombe County, what are the kind of questions that we would want to know? What kind of information could help inform our decision about whether we wanted to devote some of our resources this year? Maybe I'm missing something, or maybe that's not appropriate, but I'm trying to think of what would I want to know before I sat down to make a decision or have a discussion about should we devote any portion of what we're going to be doing during this next grant making cycle to COVID. And if somebody else has already said that, or if I'm being repetitive, I apologize.
This is Kadad. I don't think you're being repetitive. I would like to know how, if any of them have taken advantage of the silver linings within the pandemic or COVID and reached out to our students and families or essential workers and offering their space and time and expertise to support with child care or schooling.
This is Susan again, and no, Philip, I think you're right on target. I would also just wonder how many of the organizations were able to access some of the funding that was available federally to support them, and kind of wonder how long that's lasting them. When are they running out? If they did get that.
I agree with Susan as well, and I'm wondering, sorry, this is Misty again, I'm wondering, what partnerships they have, reached out into our community, since that was part of our grant process. Who were they partnering with? How were they using them? Maybe what partners have been able to assist them as well.
Great, that's a great set of topics and questions, and we'll look at how could we potentially gather some of this information in advance, and then how can we make it a rich in-person experience for those who are able to either attend or watch the video after the fact or record it for anyone who can't make it. Thinking of some of those polls where people answer questions and you can put the results up on the screen, that might be kind of neat for some of it as well. So we'll look at these topics that you've presented and put together a nice dialogue. Anything further on that?
Rachel, do you want to head right into the site visit discussion then?
Yep, sure can. We have prepared each of the organizations with information about what site visits will look like. We've been in communication with the grantees, giving the reporting forms, and said that the committee is asking for virtual site visits. And so as we get ready to schedule everybody for that round of visits, just a little input from the committee would be helpful. Is there a certain length of time that you think would be right for each group? And are there certain requests or format ideas that you would want us to convey? For example, just an interview, or do we want them to somehow incorporate tour or kind of facility related pieces or client related pieces? What are some thoughts on how the site visits could work?
I'm sorry, go ahead.
No, go ahead, Philip.
Well, my only thought is minimizing the burden on the organizations. They're already under a lot of stress, and so to the extent that we can minimize the, anytime you're getting ready to host a funder for a site visit, I think it's always, there's this power issue going on, and I'm always sensitive to what we're actually making the grantees do to get prepared for something. So anyway, I just want to keep that as a background issue.
And this is Rich. Last year, I found the interview to be an important component of the site visits, but equally important was actually seeing the facility and seeing the process and the children. So maybe they could put together a loop or a reel of some sort as compared to, a virtual walk around.
This is Jane. I would like us to have the same amount of time with each group, just to make sure that the system, the structure is as fair as possible. And also, if we could ask them to specifically speak about or lead with how the grant was used, just to remind those of us who have no memory left, that would be great.
This is Misty, and I know that Rachel and I briefly discussed this. Children and Friends had an evening walkthrough when the school was empty last week for the neighborhood, and I'm in their neighborhood for the new school. And I agree with just being able to kind of get a grasp of what the money was doing, where it was going, the new site, but also similar to what we are saying with this COVID discussion, how are they handling, all these changes? Rachel and I talked, and I know that Children and Friends has added a new classroom just for K through second grade to support families who might have older children who are home. So how have they addressed needs in their community, which is similar to what Kadada was saying earlier. And I think it's important for us as a committee to kind of know their numbers, because this is my one, example to grab from. Right now, I know Children and Friends has 2 infant rooms, and they are only available to have 1 running because they have slots for 15, but they've only got 5 babies that are coming in. So an awareness for all of us to know, this center has, slots. This, we can refer. We are a community representative to be able to know, what's available and what's out there would be really helpful, I think, in that.
So there was one suggestion in there that I wanted to make sure others in the committee provide follow-up thoughts on. Rich was suggesting maybe invite the participants from the grantees to share photos or video as part of that presentation. Is that something that seems okay to others? Good idea?
I like that. Mm-hmm. That's good. Yeah. Yeah.
Jane? You've got your hand up, your virtual hand up. I just wanted to make sure you weren't waiting to pipe in. That might be old. I was not doing a great job keeping my eye on those hands.
Rachel, how much time did we set aside for each visit? What's the total time?
It's a blank slate at this point. Got any guidance?
Well, I think, like Rich, it's important for us to see the site, see the children interacting, and the staff interacting, and all that. And it could take them some time to do a video. So, like Philip, I'm sort of sensitive to that. But I think it's important that they reserve time for us to ask questions and interact with them. It would be tempting just to take up a lot of time doing a tour, I think, and then talking, because there's a lot to say. But I think the guidance ought to be that it's very important that we be able to ask questions and interact with them and so forth.
Rachel, does that give you enough materials to work with?
I think so. Is half an hour enough time? Is it too little? Is 1 hour enough for too little?
1 hour? Leslie, is that what you're saying? 1 hour? Okay. An hour, if they're able. Looks like that's the will of the group?
Let me check what we said roadmap wise when we were going to do these. October and November is the timing that we're aiming for. So, Misty, to your suggestion around numbers and data, they will have completed their first quarter or first 3 months of the fiscal year, and their written reports are due to us by October 15th. So a lot of those will already be in hand, which will be great to anchor the conversation in numbers as well as those other points the group brought up. All right, 1 hour each with these leading questions. Try and aim for a combination of both interview and insight into how the funds are being used, and getting a chance to experience the facility or the program to the extent we can. I think
Rachel, do you envision that we'll develop a schedule with grantees, and then committee members can just participate in any of the virtual site visits that their schedule allows?
Yep, I think what we did was a sign up.
Great.
And so we will need to know the number of committee members that will be participating so that we can understand when these are public meetings that get noticed and published for other outside guests to listen in on, and when we don't reach that threshold.
Okay.
Which is why sign-ups are important.
Great. Okay, great. I think that brings us to announcements in our agenda. I'm not seeing anything from staff.
Trish, would you like to give just a high-level, quick summary of what we've got underway around COVID assistance?
Hi, y'all. I hope y'all have sounds like you have definitely had a good meeting, so I appreciate the chance to share this with you. We are looking at expanding funds, and we'll be able to know more details on that following commissioners' input on it, but we will have some funds available that will expand services to child care applicants that are above the income level for our normal subsidy program, or that's our hope. So we'll have more to that with you guys as soon as we have the details available, but are hoping that will flow through our child care arrangement that we already have in place, and will be pretty readily available as soon as we have all those details. We'll get them to you.
So is there anything to share about the town hall focusing on early childhood, or is it too soon? I don't know if we still have Zoe and Kofu on the line or not from Public Health. We'll keep you posted. As part of our COVID response, Buncombe County has set a series of town halls on various topics, and Zoe is working with the team to set one up focused on childcare. Go ahead, Leslie.
I was just asking, is that on the roadmap, or this would be an addition? Or?
It's not specifically related to the Early Childhood Committee, but we do want to make sure that we're connected. So we'll let you know as soon as it comes out. It's not on a roadmap.
It's not on the roadmap, but we did have a discussion yesterday about ECE and infant mortality rates, and we're going to focus on that for our Let's Talk the next time, but we are in the process of discussing that, so we'll let you know as soon as possible.
Thanks, Rashida.
That sounds great. Yeah.
Rachel, this is Caroline Rodier. Rachel, this is Caroline Rodier. I just wanted to update you and let you know that we are working with Zoe and Posu to set up an early childhood session sometime in the near future.
Perfect. So we've as we gather those details, Angela or I will make sure that it gets shared to the committee so that you can participate or attend.
And are we hoping that members of this committee will show up on September 15th, or is that just for grantees?
On September 15th, we hope as many of the committee members as are available will participate. It's a time for the grantees to be together with one another and get to meet and get to know members of the committee at the same time.
Thank you.
Great. Any more announcements? Okay, it looks like we have a few community members participating in the call. Is there anyone who would like to make public comment? And just to clarify, committee members are not muted, are they?
They're not.
Okay, great. Okay, I'm not hearing anyone who wishes to make public comment, so the last item on our agenda is just reviewing once again our next meeting, which will take place September 15th from 1 to 2:30. It'll be a virtual meeting where we'll have an opportunity to listen to and spend some time with grantees. And the meeting following that will be our normal first Tuesday of the month meeting in October. I want to thank everyone for a great, productive meeting today, and as always, bringing your great ideas and big hearts to this work. It's always a joy to get time together and feel like we're moving the ball forward together. We discovered last time that I have the power to adjourn this meeting without a roll call vote, so I'm going to exercise that power and call this meeting adjourned and wish everyone a great afternoon. Thank you.
Thanks.
Thank you.